to put the focus on vulnerable populations, recognising that often those groups in the population who have the worst outcomes also tend to be the people about whom we have the least data. So that's just a little bit about the theme. The thinking behind the knowledge and exchange webinars is that we do recognise that there's a wide range of population health data available, but it's not always necessarily easy to access. And we're also aware that there's considerable knowledge and expertise on how to use population health data within the academic community. So the aim of the sessions, these seminars, is really to facilitate that exchange between experts within our community to exchange knowledge, experience and solutions. So going back to the theme, we've been thinking about what's our mechanisms for change, and I think there are sort of three core mechanisms for change. One is about increased, and I'm sorry, there's a typo there, that should be public, should have picked that up, engagement on the use of data for population health research. Thinking about how to apply academic expertise, methods and resources to improve access and use of population health data. And the last one, which is where the knowledge exchange seminars come in, is really about enhancing researchers' understanding of and access to population health data. And sort of before I start talking about the data that's held by Public Health England, as a public health practitioner, it's always been drummed into me, you should start with a definition. So what do we mean by population health data? So broadly thinking about information that relates to the health outcomes of populations or specific groups of people. That could be at a national level for communities or particular ethnic groups. And that could be both quantitative and qualitative data. For this presentation, I'll be largely thinking about quantitative data. And it could be data that you've gone out and collected yourself, a primary data source, or as in Public Health England, it could be data that a secondary data use that has been collected for another purpose, but has got very rich value in terms of understanding population health outcomes. So that was just at this point we were going to, shall we switch to the mentee, James, just as people being able to complete the mentee questions?
So people have started, which is good. So we'll just give you a couple of minutes to fill in, to begin to fill in your details. It's pretty much just a click and then submit. So currently we have 12 people, so that's a good start.
So if you haven't already done it, just go to Mentee and put in the code. We use this kind of electronic questions quite a lot in the sessions that we run through Public Health England, partly because it's a really good way of getting direct feedback. We do a lot of training, so for us, when we're doing training sessions, it's quite a good way of just testing whether your audience are with you. But it's quite good. We also wanted to get a feel for the kind of people that had linked into the session. That's
We're
great.
just at 17 at the moment.
Yeah. So obviously we've only advertised this across the ARC. We were expecting, an audience largely made up of researchers, which is sort of what's coming through. Should we click on to the next question, James?
Yeah, certainly. So the next one, we're looking at your experience of using population health data in research, and also particularly using PHE data and tools. So if you'd like to continue just to fill in for a little bit, we've actually got nearly the lion's share. I think we're looking at about 24 people to fill in.
Right. So some experience, probably less experience of using PHE data tools, which is probably a good thing, and undoubtedly why people have dialed into the seminar.
I certainly think that 1.8 is the number we want in terms of the benefits of this seminar. So yes.
And then the last question before we come back to the presentation.
So this is describing your experience of using PHE data analytical tools. So have you used any of the following? So a number of people have used the Public Health Outcomes Framework, Local Health PHE Fingertips tool, slightly less using Shape Atlas, and some with the Cancer Registry data and other.
It's quite interesting. I thought everyone would have been dialing into the national COVID dashboard. I suspect that lots of people will have seen the data from the dashboard because it tends to be the numbers that are reported in the news every day. But we'll touch. So what I'm planning to do is just give a little bit of an overview of PHE tools, and we'll touch on a few examples in particular.
Brilliant.
Okay.
And then just to say, if you have any questions throughout, you can write them in this section, and then I'll talk to them once we've got onto that part. So I'll stop sharing now and then back to Sian.
Great, thanks. So let me go back to sharing my screen. So that was sort of by way of introduction, and now turning to Public Health England data and analytical resources. So just as a bit of a start, a little bit about Public Health England. We've obviously been quite in the news quite a lot recently, so I suspect most people are aware. We were established in 2013 as the executive agency of the Department of Health and Social Care, with a rail to be the national voice around public health. And we provide expert knowledge, information and evidence to inform both national and local action, with a particular remit around improving health, protecting the nation's health, and improving and reducing health inequalities. And as I suspect people are aware that in response partly to the global pandemic, it's been a really interesting time to be part of a national agency for public health. Public Health England is going to morph. There's a new National Institute of Health Protection being established in 2021, and work's ongoing to think about how to put what would be the best home for the other Public Health England functions. And I've put a link there to the policy paper that was released on that before Christmas. So in terms of data, this kind of data decision pyramid comes from a blog, a PHE blog on data decisions, and I've put the link there if you're interested. It's a really useful read, but it really talks about going from raw data, so record level data, analysing that, presenting it, visualising it, putting it with other information to provide insight to inform decision making. And Public Health England, we work right across this spectrum. So I'm going to say a little bit about how to access some of the sort of record level data that Public Health England holds. But most of the talk will focus more on this end of the pyramid, looking at some of the data tools and analysis that Public Health England produces in order to inform decision making. So much of the data that we use is actually secondary data collected by other organisations, but we do have some primary data collections, and I've listed them there. This list comes from a paper on surveillance published on the Public Health England website. As you can imagine, a lot of the data that we hold, which is primary data, relates to health protection. But there's also vaccination and immunisation services, a range of data across a number of other areas, and probably the other big area for us is disease registration, as we host the National Cancer Registration Service. So we do, we are very keen for people to use the data that we hold in order to improve population health. We do subscribe to the Open Government Licence. So most of the tools that we publish, in fact, not all, all of the tools, you can usually access the data that's underpinning them. But obviously some of the data that we hold, if it's record level, can't be put into the public domain because it runs the risk of identifying individuals. So in order to make use of that, we have something called the Office of Data Release. So if people are interested to use non-publicly available data for a range of purposes, including research, that's the place to go to. So I've put a link to the Office of Data Release there. Each application is reviewed on a case-by-case basis, and obviously all applications are subject to the strict confidentiality rules. But if you want more details about that, that's available through the ODR website. So we do publish a range of resources which are more to sort of that top end of the pyramid, looking at different data and analytical tools to inform decision making. So sort of to get, and there's probably more that I've got time to talk about in this presentation. There's a couple of resources which are good places to start if you want to get a feel for for the range of products that we produce. One of them is our signposting guide. So this is on our Knowledge Hub site. So that gives you a sort of an overview of where to look when you're starting to look for data. And there's also this page on gov.uk, which has a range of data and analytical tools. And I've put links to both of them there. And these are the resources that I'm just going to talk very briefly around. I don't think we can avoid coronavirus at the moment, so I'll say a little bit about the coronavirus national dashboard, a little bit about the wider impact of COVID, because obviously, although the focus is very much trying to contain the acute infection at the moment, we are very conscious of the wider impact that COVID and the lockdown are having. Say a little bit about Fingertips Data Platform, which is our main route for publishing data and health indicators. And then there are a number of resources. If we have time, I'll just say a little bit about, just to make people aware of that they're there. So just to start off with the coronavirus dashboard. So as I say, these are the numbers that you probably see in the news each day. This is a site that's on the gov.uk website. It's updated on a daily basis and gives information on the number of people testing positive for COVID each day, the number of deaths within 28 days. There's information from the NHS around the number of people admitted to hospital, and then on the number of tests, and increasingly looking to the sort of on the bright side, to the future, the number of people who've been vaccinated, which is going up very quickly. So that gets an amazing number of hits. They get hundreds of thousands of hits every day, reflecting the widespread impact of the coronavirus and the COVID pandemic. If you're interested, also on the website, you can drill right down to small area to get an understanding of the level of infection in your area. So this is just a screensaver shot. You can put your postcode in and see what the situation is like in your locality. And obviously, if people have got questions about that, we can come to back to that at the end. I mentioned the fact that, obviously COVID is having wide-ranging impact, and so we do have a new tool called the Wider Impacts of COVID monitoring tool, or the WITCH tool. This looks at data across a range of indicators to get a feel for what's been happening to the population over the past year across a range of areas. So if you go into the tool, you'll see that it's got information on sort of grocery purchasing, food usage, some of the social determinants of health, mental health and well-being. I think clearly we're all aware of the potential impacts of lockdown on mental health and well-being, behavioural risk factors, access to care, air quality, pregnancy and birth, and life expectancy. And I've just pulled out a couple of examples. Most of the data in the tool is at national or regional level, and I've just pulled out a couple of examples relating to the use of alcohol. So this is the percentage of adults who consume alcohol during, sort of before lockdown, during the first lockdown, and then as we through summer into August and September. And you'll see that across the nation, actually, there was an increase in the number of people who didn't drink at all. But of more concern, if you look down at the other end, actually, there was also, amongst those who do drink, an increase in those who are drinking higher levels of alcohol during the week. And this is again shown in this data. This comes from the alcohol toolkit study at UCL, and you can see across both social groups there was a marked increase in those prevalence of higher and increased in higher risk drinking during the sort of lockdown period. So that was the wider impacts of COVID tool. Most of the profiles that we produce are published through the Fingertips platform, and this is the home page of the fingertips platform. Again, this is open access, so this is open access to the public, although it is largely aimed at a professional audience. And you'll see that there's a wide range of profiles across a range of health topics. I haven't got time to go into them all, but actually, if you understand how to use one profile, they all look very similar. You can use the others. So I've just sort of got a few screensaver shots from the Public Health Outcomes Framework. So when you go into a profile, this is what it looks like. And you will get these sort of indicators which grouped in different health domains along the top. And then this bar gives you the option to visualize the indicators in lots of different ways. You can map the indicators, you can look at how they change over time. If you want them, you can present them as box plots. And generally, they are benchmarked usually either against the England average, or you can benchmark them against your areas of similar statistical neighbours. So if I just go into give you some examples, so this again comes from the Public Health Outcomes Framework. So this is looking at some overarching indicators, looking at healthy life expectancy for men and women and life expectancy from birth. And this is looking at regional levels, so it's comparing to England, and you can see it's very nicely demonstrating the fact that areas in the north of England tend to have worse outcomes, with sort of red indicators for the northern and Yorkshire regions. Here we are, east of England, green overall, but we know that that hides significant variation in health across the region. This is a different example down here, but just to show you how you can visualize the data. This is data from the National Child Measurement Programme, looking at the prevalence of overweight and obesity amongst year 6 children. This time it's looking at local authorities within the east of England, and again benchmarking against England. So you can see that overall, although rates of child obesity are lower than the England average, we do have some local authorities which have higher rates. But actually, this is one of those indicators where green is a bit misleading, because actually, if you look at the level of obesity, we probably want all areas to have lower rates. Again, this is just looking at another example showing that how you can show trends over time. So this is looking at under mortality due to liver disease in people aged under 75, again at regional level, and you can see that this is one of those indicators that has been going in the wrong direction in most regions, but actually London is one of those ones where it's bucked the trend, and they're called indicators for a reason, because really, once you've seen this, you want to delve in to understand what's going on, to understand these different trends in different regions. And I think this is my last example from the Fingertips platform. Again, as I mentioned, you can map the data. You can also correlate one indicator with another. So this is looking at school readiness, so children in reception age who are attaining a good level of development at the end of reception. So this chart is showing how that compares against child poverty. So this is looking at the proportion of children who live in low-income families compared to levels of development for children with free school meals. Sorry, I'm here around my monitor just to double check that. And actually, this is one of those ones where it bucks the trend. So actually, you get better outcomes in children who live in more deprived background, from more deprived areas. And this is just how it looks on one of the maps. And then this is a slightly different profile. So this is from our general practice profiles. The practice profiles has a profile for every general practitioner practicing in England, and I've just pulled out some examples of some of the data from here. You can get a sort of population pyramid for each of the general practice, and it really shows the different age structures that you get between different practices. All of these 3 practices are in Norfolk. If we were able to have a bit more face-to-face interaction, I might ask you which areas you think this might be. This one obviously has a very high student population, so it's linked to UEA. This has a younger population. I think it's the Thetford area, And obviously this practice has a much older population from an area in North Norfolk. But again, as with the other fingertip profiles, you can go in and see how indicators change over time, and also do correlations to see, for example, how the indicators in different practices compared to levels of deprivation. So we do have a number of, and I know often people are very keen on seeing, interested in drilling down to small areas. A lot of the data that we publish is at regional or local authority level. Like the general practice profiles, we do have some profiles that go down to small area level, and local health is one of these. You cannot access all of the local health indicators through the fingertips profile. There is also a standalone website, and all of these tools that I'm talking about, I've put direct links into the presentation, which we'll make available afterwards. I think the thing about local health I quite like, one, you can map, so you can map down to regional level. So this is an example looking at how a measure related to child poverty, the income deprivation index affecting children, ADAPI maps across our region. But you can also create bespoke profiles for local geographies. And this is an example of this. So here I've gone in and selected 2 wards, neighbouring wards in Great Yarmouth. They don't have to be neighbouring wards, and I've just picked these at random. But once you select those, what local health will do is recalculate the data for your bespoke geography, and then produce a bespoke report for your area, which I think a really useful resource to be aware of. And then the other mapping tool that can allows you to drill down to a small area is Shape. I know a number of on the call might have done Shape training that James ran recently. Shape is the one tool that isn't automatic open access, and the reason for that is some of the restrictions around some of the data that Shape presents means that it just has to have a registration process. But if you apply, and this is a link to the home page, and you'll see that there's a link there to complete the registration form. Usually the Shape team are very quick about getting back to you and allowing access. Shape's been around for quite some time. It was originally started as a resource to allow mapping of the NHS estate. It's grown quite considerably over time since then, and now allows you to map a range of resources, both within the NHS and outside, but also to overlay that with a range of health indicators. So this is an example that I've just pulled out. So this is looking at the Sustainable Transformation Partnership level, STP level. So this is Suffolk and North East Essex. And within this one, I've selected all of the general practitioner practices within Suffolk and North East Essex. So this, all of the green circles that you can see here are the general practices. And I've chosen to overlay that with the index of multiple deprivation, a measure of multiple deprivation. And that's just one example. There are a range of indicators that you can select, and indeed a range of different organisations. This is at sort of quite a high level, but obviously you can drill right down to an individual practice level to get an understanding at a small area. I think the other thing that Shape's really good about is it also allows you to look at travel time to different organisations. So this is that same view, looking at Suffolk and North East Essex with general practices selected. And this time on the left-hand side, I've got the travel time resources open. So this is mapping all of the general practices, looking to see what parts of the SDP are within 30 minutes bus ride. So that's the sort of yellowy shading that you can see here. And for those areas that are outside that, the Shape tool selects that, and it shows you what portion of the population are outside that 30-minute bus ride limit. So it's a really good way of getting a measure of equity of access. It gives you a sort of information about the population who are either within that travel time or outside, whether it's a rural-urban mix, and also information about the level of deprivation. And you can, I haven't got a screensaver shot, but if, for example, if you're planning services, the tool also allows you to put in a new pointer. So if you are planning a service, you can put a pointer into the map. It will recalculate and show you what impact that has in terms of service of population access to that service. And then just last on the Shape tool, just to flag that we have been working with the Shape team to add in information about ARC projects, so the Shape Atlas. So this is just a screensaver shot of what that looks like at the moment, and the data is very early days data, so not finalised. So don't it's moved on a lot since then. But we've got information about each of the different projects across the ARC, linked to different themes, and that's been visualized on a particular within the Shape Atlas. And then just the last two data tools that I was going to talk about before we sort of open up for questions and discussion were slightly different. So the first one is the global burden of disease. So I know that many academics within this region are working as part of the Global Burden of Disease project. This is an international project looking to map, sorry, I think we've got thunder behind, which is slightly throwing me off my train of thought. But it's essentially, it's an international exercise to look at understanding the global burden of disease across populations and countries, looking to estimate the level of mortality and morbidity, usually at country level. But Public Health England has been working with the team behind the global burden of disease and has now made those estimates available not only down to regional level, but also down to county and unitary authority level. And I've just taken one screensaver shot of what that looks like. So if you look on the right-hand side, sorry, the left-hand side, you can see the different geographies that the global burden of disease estimates are available at. Again, you can visualize the information in a range of ways. This is sort of like a square pie chart. Essentially, it's dividing the total burden of disease at this one I've selected is at regional level for the east of England, and grouped it according to the different causes of mortality and morbidity. And you'll see that in a normal year, the vast majority of the burden of disease is linked to chronic conditions. This is this big blue box, and infectious diseases makes up a much smaller proportion of the total burden of disease. Clearly this year is very different, sadly. And then the last resource that I was just going to signpost people to, and I know we have a health economics theme, that there is also a range of health economics resources produced through Public Health England. We haven't really got time to go into them all. Now I've just put a sort of screensaver shot to the page, but there are a range of resources looking at return on investment around particular topics. And also a prioritisation framework to help local areas collate the information and evidence and make to inform decision making about services and resources. And I just want to include a sort of signposting to that link as well. I think that's the last of my slides. Oh no, just before we finish, just to say that all of the resources that I've talked about there, I've put links to both embedded in the slides and here. And there's just a couple of things that I'll probably highlight before we sort of turn to questions and discussions. I think right at the start of the talk, I mentioned the Public Health Matters blog. That's a regular blog that has information around a range of public health issues, including public population health data. It's a really useful blog if you're not already signed up for, so I've put a link to those there. And just to say that within our local knowledge and intelligence team, that's our local team, we have a regular e-newsletter that provides updates on new releases and resources from Public Health England. And again, if you're interested in signing up for regular updates, please just do drop that email a line. I'm going to stop there and maybe sort of turn to see whether there are any questions or open it up for discussion.
Hi, Sian. We've got one question on the mentee, so please do feel free to add any more. And I think essentially you've answered it. So